pass-through quality control. WHO very recently in the last conference had said at the last national conference on health, the emergency on Ebola, had said that all PPEs that come into the country must have pass-through quality control specified by WHO. So what that means is that every PPE that comes into this country, before we can recommend it for a healthcare worker, we're sure that it has passed through quality control. And then going further, they have to have some training, some level of training to know how to put on that equipment, because if you leave a room, then it's possible that you may be wearing that equipment wrongly. And therefore, we encourage that all healthcare workers who are going to be wearing that equipment should be trained before they even approach an Ebola virus disease patient, so that they themselves don't in turn become a victim. So these are some of the things that we're recommending. And in terms of the isolation units, the isolation units are built in a way that you have an anteroom, which means as you arrive the isolation, you have to take off your clothing, and then you put on, following the protocols, you put on the PPE itself before you get into the isolation unit where the patient may be proper. And at the end of the exercise or seeing the patient in the isolation unit, you're supposed to get into another anteroom and follow the protocol, take off the PPE, and actually have a bath before coming out into the open again. So with these kinds of processes, it is possible that our healthcare workers will stay safe once they're in an environment where there's an Ebola virus disease patient.
What about you?
Well, to add to what he has said, I think one of the reasons why we see have spread, there are just basically two reasons. One, when is the effective period of this disease? People don't actually really understand. People have talked about the 7-day, the 10-day, and all
21
of that,
days.
the 21 day. But one thing I like to clarify is that depending on the load of virus, which will then be determined by the modes of transmission. If you have a plague that is pouring in the virus into your system, is different from when you're just having it from sweat, or you're having it from somebody that is, or secretion that is just touching on your skin. Depending on the viral load, that will determine the period at which the symptoms will begin to manifest. If the viral load is much, then the viremia comes up on time. And that means by the third day, or the second day, you can begin to have symptoms. And the person can come down after the fourth, fifth day, and it can become so infective. So you can't talk about waiting for the 10th day before you talk about the infective period. And that's where people have got to miss it. I have often talked to people, even particularly our health worker, assume that every patient is an Ebola patient, and you must treat as well, and then adopting the universal precaution. So that will make us not to ever contact it. Then two, quite a number of people, again, are still in the denial phase, saying Ebola virus disease does not even exist. And so we must not relent in our sensitization. We must continue to show to them in various forms,
For example, the bushmeat sellers.
Yes, they will tell you that the index case that came to Nigeria was through human-to-human contact and not through the animal contact.
Which is fair enough. We've been eating bushmeat since forever. We've never had to bother about that.
It sounds to the reason, but of course, you just heard what they said now. What if some of these animals travels, take a bite on the fruit and it gets to drop, and then you don't know how all that can spread? Of course, when people ask me about eating bushmeat, you can eat bushmeat, but the person that is at risk is the person that's going to prepare it. By the time you are eating, the bushmeat is already well cooked and you are safe. But that person who's going to prepare it is at risk. So we need to really get more people to key into this and get not even any person, but more of people that are in higher authority, like a traditional ruler, who can call his town crier to go around and continue to sensitize the people.
Talking about traditional institutions, a quick one here. Do you have any instance of people claiming to have, the cure for the EVD, especially among
of course,
because we have that case in Delta State, and the government quickly went to town to tell them to stay off, that no one has any scientific claim to the cure for now. So
you see, they linked this Ebola, like in the southwestern region. I had one, I think, in Osun State. Somebody said that it's the same as the shockmono that they had some few years back, and that they were cured for that at that time. And then there's a traditional way to cure. Of course, we have to quickly dispel that and say that is absolutely untrue for our people who have gone to. Of course, it is not correct for anybody to come up and link one disease that is prevalent now to shockmono of those days. And I think shockmono they call it chicken pox or something, or smallpox, I don't know. So that is not same as we have now. This virus, is virulent, and is the problem. That's a major problem. When you look at the category of the hemorrhagic fever, this is actually the most virulent. It's on the top. And then you look at things like the Lassa fever, dengue, yellow fever, and all of that going down. And it tends to be like the more virulent the virus tends to be, the less the ability to survive outside the body. And then the modes of transmission and all of that. So, of course, people should not believe, that any traditional something or any concussion will cure that at the moment. No, we have actually tried to dispel that. But what we have done actually, like back home, is that our traditional institution, of course they will gather to celebrate Ogun, celebrate all their festivals. And one thing we have done is that, like the Ogun that will happen in Ondo, we had to come in there. First and foremost, it's going to be a very local thing. You're not bringing people from outside to come and join you in celebrating it. Then secondly, of course, the Kabiyesi was so magnanimous to come and let us talk to people, using our public health experts, to talk to people about hand washing, using sanitizers, and then avoiding contact at this moment. And we believe, that again is a new innovation, integrating even public health into even the celebration of the Ogun Festival.
Well, we'll go on a break and we'll come back to you and both of you so that we can just talk more on, still on prevention, because we have talked about symptoms and so many other issues. Look at the traditional institutions. We'll come back from this break. We'll look at more on prevention of the EVD and how we can actually stay healthy, and more of those hygienic culture or habits that we should all imbibe. Well, Sunrise takes a moment now, and we will return.